As we talked about, safety is really important, especially if we're working with a patient that has challenges with their balance. So on their card, you'll see fall risk, or you'll see the acronyms SBA for standby assist, or CGA for contact guard assist. If you see any of those three indicators on a patient's chart, we'll want to make sure that we're not only staying close by to the patient when they're on their feet or doing any exercises that involve transferring on and off of machines, but that they also have this handy-dandy gait belt on them. So one thing that you'll notice with a gait belt is that one side has teeth and one side is smooth. So the way that you want to put it on is with the teeth out this way. So that way when you wrap it around, you can feed it back into the teeth. Zach, go ahead and step up so they can see this here. So when I do this, I get close by, I give them a little reach around. One thing to make sure is that they don't have any like feeding tubes or cords here on the front. You can always feel free to ask if you feel uncertain, but we try to mark those down as providers. So now I have it wrapped around and snug. I always feed it through the teeth side of the belt first. You feed it up through the teeth side here, and you pull it till it gets tight on them. I pull it that way. And then once it feels pretty tight, then I can slide that down into the smooth side of the belt and pull that tight as well. A lot of people like to tuck in the extra tail if there is one, just like so. The one thing is you want to make sure it's snug. So if it's not snug enough, you can always pull there and create a little bit more tension. You always want to check. How's that feel? Is that okay?
That's great.
Awesome. So that's how you set up with a gait belt. And we'll want this on everybody that has either a fall risk written on their chart or a CGA for contact guard assist or an SBA for standby assist. So here's what we need to do for standby assist. Standby assist literally means I'm standing within half a step away from the patient at all times. And what I'm ready to do while I'm monitoring how they stand and if they have any what we call sway in their body, I'm making sure that if they lose their balance that I'm ready to step in and grab that gait belt. Where we place the gait belt is really important. What you notice is that I placed it right around where his belly button is because that's at the center of his mass, which makes it the easiest to control his body. Even just a small tug with 2 fingers can pull Zach all the way back. So if he's falling backward, I can do a small tug and keep him upright forward. So standby assist, if he's doing an activity, go ahead and do some high marches here, Zach, in place. I'm here and I'm ready and I'm anticipating. My attention is nowhere else but on Zach. This is not an activity to have your attention called away from. Good. Oh.
Whoa.
So he fell right there. So I'm not grabbing arms. I'm not grabbing limbs. I'm grabbing the belt. Not only am I controlling his center of mass, I'm making sure I'm not creating any issues at his shoulders by pulling on his ligaments or his tendons that are vulnerable in the shoulders. Now that's for standby assist. Contact guard assist means you're always going to be in contact with the belt. And I always do this the same way. I'm always on the back side. For people who are a little bit better on their feet and not completely horrible for balance, I'll just do one hand in the back here. If I'm not feeling confident enough with that, go ahead and turn this way, Zach. Then I'll do 2 hands. I'll do one in the front and one in the back, and I'll be here. But for most of our patients, you'll notice that it's only the one hand on the back side. So we'll go ahead and turn back so they can see. Notice that what I'm doing here is I'm just laying my fingers flat on the small of his back. I'm not actually influencing the belt at all, as that actually makes it harder to do balance activities if I'm influencing his center of mass. I'm actually just there, as what I say, along for the ride. So as Zach's marching in place here, I'm just going to be here, and I'm just gently pressing into his back, not affecting his base of support. He's doing it all by himself. He just has the confidence that if he did lose his balance, that I'm there to help him. So you can see that he wasn't able to get far, and Zach was trying to fall, and I wasn't going to let him fall. So having that belt in the right spot and making sure you're anticipating helps to be able to keep them upright. Now, one thing that can happen at times when we're working here, especially with a lot of patients, is you can feel like you're in tight quarters and that you don't have enough space. So the expectation that I give is that my elbow is bent at about 90 degrees, and that's about how far away I want to be from a patient. So let's go ahead and turn this way, Zach. So sometimes I'll be right behind the patient because we got traffic coming this way, but that's okay because I'm right here and my elbow's bent at 90 degrees behind him. If you can't see, I'll do it right here. My elbow's bent at 90 degrees and I'm right behind, right? If we're going sideways and there's a machine coming, sometimes what I'll do is I'll even shift from one hand to the other, like so. You can shift from one hand to the other so that way you can swivel to one side of the body versus the other side of the body. But at all times, I'm within half a step because my elbow's bent at 90 degrees. just like so. So what are the mechanics if a patient's doing an exercise that involves laps and they're turning? We'll start on this side of the screen and we'll start marching toward the wall here, Zach. Good. So good. Go ahead and turn around for me. So I can either whip fast around, which can be difficult at times, especially for an abrupt about face like Zach just did, or what I usually do is I just kind of switch hands and I'm ready for the turn. That tends to be a lot easier for people. Now, there's going to be some times, Zach's a great patient, there's going to be some times when people say, I don't need that belt, but they have fall risk, contact guard assist, or standby assist written on their flow sheet. The first thing to do is to assure them right away, oh, we just want to make sure that you stay safe. I have all the confidence in the world that you'll do great. I'm just here just in case. You're doing all the hard work. That's the best approach to take. If they still have an issue with it, guide them over to a seated position and then say, you know what, let me go check with your provider really quick. Something that you can come let the provider know is say, hey, I was working with Zach and he wasn't really wanting to wear the belt. Is he actually okay to advance to a standby assist from a contact guard assist or advance away from a standby assist altogether? Because that can happen as patients get better. If they say yes, great. You'll have wonderful news for that patient that you won't have to intervene quite so much. Or as most of the time happens, they'll indicate that this person still needs the belt and we can come back with confidence saying, yeah, I talked with your provider. They still want you to wear the belt just to make sure you're safe. But don't worry, you're doing all the work and I'm just here just in case.